Hey everyone. Sometimes you hear a news story, and even though it's happening far away, it still feels really close to home.
Yeah,
Well, we're doing a deep dive today into a recent measles outbreak in Texas,
right.
and tragically, a child passed away from it,
Yeah, it's just
which is so sad.
it's really heartbreaking.
Yeah.
And
Oh, we're going beyond the headlines.
yeah, we're going beyond just the headlines because even if you're nowhere near Texas, this case really has implications for everyone.
Yeah.
We're going to uncover some really interesting aspects of this case,
Well,
like the community where it started,
hmm.
just how contagious measles is,
Right.
and how this all ties into this trend we're seeing of vaccine hesitancy.
It really makes you think.
It does.
Okay, so let's start with the human side of this story.
Okay.
A school-aged child in Texas who was unvaccinated sadly died from complications from the measles.
And what's really concerning is that this isn't an isolated case over 120 people.
Wow.
Mostly kids and teens have been infected just in Texas.
Right.
And it's spread to New Mexico.
Oh, God.
And the vast majority of them, almost all of them, were not vaccinated.
Yeah, it's a scary reminder of just how serious measles can be.
It is?
I remember when I had the measles as a kid,
Yeah.
it was just a few spots and some itching.
Right.
Why is this outbreak so different?
That's a great point
Yeah.
because while some people do have really mild cases, measles can be incredibly dangerous.
Right.
It's so contagious. Think about this. If someone with measles sneezed in a room and then left,
Oh, wow.
you could walk in hours later and still catch it just from being in that same space.
That's a powerful image.
Yeah.
It really puts it into perspective.
It does.
And you mentioned complications too, right?
Oh, yeah.
From measles.
Absolutely. About 1 in 20 children who get measles develop pneumonia.
Gosh.
It can even lead to brain swelling, cognitive issues, deafness,
Wow.
and as we've sadly seen in this case, death.
Yeah.
Before we had the vaccine, measles caused hundreds of deaths every year
Wow.
in the U.S. alone.
It makes you realize we've come a long way,
Yeah,
but we can't take that progress for granted.
we can.
Speaking of the vaccine,
Yeah,
that's usually the MMR shot.
right.
Measles, mumps, rubella all in one.
Exactly. And the MMR vaccine is incredibly effective.
Yeah.
The protection it offers is just vastly greater than any perceived risks.
Right.
And so this outbreak really underscores how crucial vaccination is to preventing these kinds of tragedies.
So how did this outbreak even start?
It started
Was it just bad luck, or is there more to it?
in a very specific place.
Okay.
It started in a close-knit Mennonite community
Okay.
in rural Texas, and this community is known for having very low vaccination rates.
Right.
And so that unfortunately created a perfect environment for the measles to spread very quickly.
So it wasn't just bad luck.
Right.
It was a vulnerability in the community's immunity.
Yeah.
And this reminds me of something else I read about vaccination exemptions soaring in Texas.
Mm-hmm.
Is that connected at all?
You're picking up on a really crucial point here.
Okay.
What's happening in Texas is part of a larger trend we're seeing across the U.S.
Okay.
More and more parents are choosing to skip or delay vaccinations for their children.
Wow.
In fact, a recent poll found that number has jumped to nearly 1 in 5 parents nationwide.
1 in 5?
Yeah,
Wow. That's a lot higher than I would have guessed.
it is.
Is that why Dr. Celine Gounder has been speaking out about this?
Yes,
I know she's a well-respected expert on infectious diseases.
she is. And Dr. Gounder is deeply concerned because this trend of vaccine hesitancy is happening alongside the spread of misinformation online.
Yeah.
And this makes it really hard for parents to separate fact from fiction when making decisions about their children's health.
That's a really important point.
It is.
So we're seeing a perfect storm here.
Yeah, we are.
Lower vaccination rates, misinformation spreading, and then this highly contagious and dangerous disease like measles.
Yeah.
It seems like we're almost going backwards in time.
You're right. We have this amazing tool to prevent a serious disease.
Yeah.
Yet we're seeing a resurgence because of these growing concerns about vaccines.
That's a really thought-provoking point.
It is.
What does this mean for all of us,
Yeah.
even if we're not directly affected by this outbreak?
Right.
What's the bigger picture here?
It's a great question.
Yeah, it feels like we've stumbled on something bigger than just one outbreak. This idea of going backwards, of having this effective tool,
Right.
but not using it
Yeah.
fully. It raises so many questions.
It does. It certainly does. And one of the most crucial questions is this: what responsibility do we have, both as individuals and as communities, to protect those who are most vulnerable?
I'm guessing you're talking about people who can't get vaccinated,
Exactly.
like babies, Or those with compromised immune systems?
Yeah, like babies or people who have compromised immune systems for medical reasons, they rely on what we call herd immunity.
Okay.
Think of it like a shield,
Okay.
protecting a community.
Mm-hmm.
When enough people are vaccinated, it's like a strong, solid shield.
Right.
But if too many people aren't vaccinated, that shield weakens.
Oh.
And those who are most vulnerable can slip through the cracks and get exposed.
So it's like a domino effect.
Yeah.
One person's choice not to vaccinate can actually put others at risk.
Yes.
Even if they're not the ones directly exposed.
That's the heart of it.
Wow.
It's not just about individual choices.
Right.
It's about the collective well-being of the entire community.
This makes me think about the Mennonite community where the outbreak started.
Yeah.
Is there a specific reason why vaccination rates are so low there?
That's a great question.
Yeah.
And it really highlights the complexity of this issue. In this particular community, there are deeply held religious beliefs that influence their views on vaccination.
Okay.
They value natural immunity and often rely on traditional healing practices.
So it's not just about misinformation.
Right.
Or fear-mongering in their case. It's about a different set of values and beliefs.
Exactly. And this underscores the importance of approaching these conversations with sensitivity and understanding.
Right.
It's not about judging or forcing beliefs.
Yeah.
It's about fostering open dialogue and finding common ground.
That's a really important reminder.
It is.
Yeah, it's easy to get caught up in the science and forget that there are real people
Absolutely.
with real beliefs and concerns behind these decisions.
Yeah.
But going back to the science for a moment,
Okay.
how exactly does this herd immunity thing work?
Okay.
I get the shield analogy.
Yeah.
But what's the actual mechanism?
Here's where it gets fascinating.
Okay.
When a high percentage of the population is immune to a disease, either through vaccination or previous exposure, it creates a barrier to the spread of that disease.
Okay.
The more people who are immune,
Right.
the harder it is for the disease to find a susceptible host and take hold.
So it's like the disease is constantly running into dead ends.
That's a great way to put it.
Yeah.
Unable to spread effectively.
And this protects not only those who are vaccinated, but also those who can't be vaccinated.
Precisely.
For medical reasons.
It's a powerful concept that demonstrates the interconnectedness of public health.
Yeah.
Our choices can impact not just ourselves, but also those around us.
It makes you realize that vaccination is not just a personal choice. It's a social responsibility.
Yes.
But I imagine there are people who might disagree with that perspective.
Of course, there are always different viewpoints and perspectives on complex issues like vaccination. Some people believe that individual liberty should take precedence, while others emphasize the importance of community well-being.
So how do we navigate those differing opinions?
Yeah.
It feels like this has become such a polarized topic.
That's one of the biggest challenges we face today.
Yeah.
I think the key lies in fostering respectful dialogue, listening to each other's concerns, and focusing on the shared goal of protecting the most vulnerable members of our society.
It sounds like it requires a shift in mindset.
It does. From thinking about me to thinking about we.
Exactly.
Yeah.
We need to recognize that public health is a collective effort.
Yeah.
And our actions can have ripple effects far beyond ourselves.
This deep dive has been incredibly eye-opening. We've gone from a single outbreak in Texas to exploring the science of herd immunity, the complexities of individual beliefs, and the importance of community responsibility.
Yeah, it's a reminder that even though the situation might seem bleak at times, understanding the facts and engaging in thoughtful conversations can empower us to make a difference.
We're all in this together, right?
We are.
And knowledge is the first step towards positive change.
Absolutely. Knowledge is power. And in this case, it's the power to protect ourselves, our loved ones, and our communities.
I'm feeling a bit overwhelmed by all this information, to be honest. It's a lot to process.
It is.
What's the one key takeaway you'd want listeners to walk away with from this deep dive?
It's a lot to take in.
Yeah.
It is. I'm still grappling with how interconnected everything is.
Yeah.
Like individual choices impacting community health, misinformation, spreading alongside like real concerns. It makes me feel like we all have a role to play here.
You've hit the nail on the head. The key takeaway here is that we're not powerless.
Okay.
We can each make a difference, starting with ourselves and our own families.
So what does that look like in practice?
Okay.
Where do we even begin?
Well, first and foremost, Make sure that you and your loved ones are up to date on your vaccinations,
Okay.
including the MMR vaccine.
Right.
If you have any questions or hesitations, talk to your doctor
Right.
or a trusted healthcare professional.
Yeah, it's always better to get information from a reliable source
Exactly.
than, going down the rabbit hole of online forums or whatever.
Absolutely. And if you encounter misinformation about vaccines, don't be afraid to speak up.
Okay.
Share accurate information from credible sources,
Right.
like the CDC or the World Health Organization.
Right.
You can be a voice of reason
Yeah.
in your own circle.
Like almost becoming a vaccine advocate
Exactly.
to your friends and family.
Yeah.
I can see how that could make a real difference.
They can.
Is there anything else we can do beyond our immediate circles?
Absolutely. You can support organizations that are working to improve vaccine access and education.
Okay.
Especially in communities with low vaccination rates.
Right.
Sometimes it's about more than just sharing information.
Right.
It's about contributing to systemic change.
That makes sense.
Yeah.
So we can be informed.
Yes.
We can speak up. And we can support organizations doing good work.
Right.
It's empowering to think that we have some agency
We do.
in this situation.
Absolutely. It's not about fear-mongering.
Right.
It's about empowerment through knowledge and action. Every step we take, however small, contributes to a healthier future for everyone.
This deep dive has been a journey, to say the least.
It has been.
We started with a tragic story in Texas. We explored the complexities of vaccination and herd immunity.
Yeah.
And ultimately, I think we landed on this message of hope.
I think so.
And action.
It's been a privilege to unpack all of this with you and with our listeners.
And to our listener out there, thanks for diving deep with us today. We hope this conversation has provided you with valuable insights and empowered you to engage in these crucial conversations. Remember, knowledge is power, and we can all be a part of creating a healthier future for ourselves and our communities.